Hello, everyone. My name is Linda Uboti. Um, I I guess I can say I'm not that new to social work. I've been around and been in the field for a little bit, not as a social worker, but in different capacities. Currently, I'm a crisis clinician at a hospital outside of Philadelphia, a very busy hospital. In crisis, what I do is I see most of my patients in the ER. I see patients who are experiencing mental health crises and also drug and alcohol crises. I assess, uh, pretty much triage, and in the evaluation, make a recommendation for what the patient next step should be in collaboration with the patient, the ER doctor, and the ER nurses. We figure out what the patient needs are and make a recommendation for what the next step should be. I also see patients that are on the medical floor I'm a consult, so I'm a consult to the doctors and to the hospital staff if needed. In my internship last year, I was fortunate enough to get a worksite placement, and I was also very fortunate to work with three very excellent social workers in three very different capacities. I worked as an intern at palliative care um, at the Geriatric Assessment Center and also the Memory Fitness program that the hospital provides. So it was three different level of social workers from three different perspectives, and they were all very good at what they did and uh, very good teachers. I was able to watch and learn. Memory Fitness Center, what they did, it's pretty much like a day program. Starts from 11, goes until 3. They do patients who are in their early stages of Alzheimer's, dementia, come in and do different programs, sing along. They pretty much run the program. There's lunch provided. There's conversation piece, and they basically focus on life as they knew it before. And there were some also current events that were discussed during the program. Um, so I did that, and then geriatric assessment center. Those are people that are either are in the early stages of dementia or already were diagnosed with dementia or late stage of dementia come in with their family members who are looking for answers as to how to help their loved ones, how to provide and take care of their needs. And that was very difficult for me because I also have a grandmother who's struggling from dementia right now. So just seeing the eyes of the family members as they're looking for answer and they're looking for hope and they want you to tell them something else that this is going to get better and everything will be okay and breaking the bad news to them that their loved one is still here, but the way they perceive things are different now and they have to change their mindset and change their way of thinking when they're working with their loved one and providing for their needs, and what the loved one is doing is not personal. It's a very difficult conversation to have with family members who were holding out hopes that things were going to be normal again, quote unquote. At palliative care, that was working with patients as a counsel to the doctors. What we discussed with the family and also with the patient was goals of care. Um, that was hard. That was very hard because we were dealing with difficult diagnosis and prognosis, and sometimes the prognosis and the diagnosis was what was going to kill the patient. And that was a conversation you had to have with them also, and have them look at the whole picture of what was going on with them versus just what was going on with them at that time. And looking at family members who are hoping and praying and don't want to give up, and also looking at a patient who has come to terms with what's going on, and being in two different places with their loved ones. That was also a difficult conversation. I started this by wanting to work with kids. That was my goal going into social work. But the more, especially my internship last year, I was able to see a different side and a different perspective, and look at social worker through a different lens, and I like working with the older population also. So I am in an internal conflict as to where I want to head next with this one. I'm still exploring, so hopefully I should be able to figure it out soon, um, especially with my next internship. But I have learned a lot throughout the years, but I learned a whole lot with my internship, and I gained a lot of insight on the different uh, social workers out there and what they do with their patients and how to support the patients and their families, and the different perspective um, that they bring to the table as it relates to their work with their patients and the patient family. So I look further to exploring social work, um, and hopefully in exploring that I'll be able to figure out what I really want to do, and which population I would like to work with. But I look forward to working with all of you in this class, and hopefully I can learn a lot from you also. Take care.